Hello everyone, welcome back to another very interesting and super helpful video for all the wonderful nurses around the globe. From Nurses, the Heart of Healthcare. Keep learning, keep growing. My name is Shenaz and this video is going to be of super help for all those nurses who are looking forward to work in any of the Gulf countries like Saudi, Qatar, Bahrain, Oman, Dubai, Kuwait. Yes, so all those nurses who are aspiring to work in any of the Gulf countries, they are actually required to crack the Prometric examination for nurses to get their license to work in that particular country. And this examination will have MCQs, that is multiple choice questions, okay, which will cover all the 7 domains of the nursing. Okay, adult health nursing, pediatric health nursing, mental health nursing, yes, maternal health nursing, geriatric nursing, community health nursing. Okay, it will cover everything. So the questions will be from all everywhere. Okay, so we need a thorough preparation, and Nurses, the Heart of Healthcare, have come up to help all those wonderful nurses with Prometric examination for nurses module. And in this module, we'll keep uploading the videos with 15 questions being discussed in each. Okay, 15 MCQs being discussed in each, which will help you to prepare and practice for your Prometric examination. Okay, so let's get started. But before moving ahead, a small and gentle reminder to all my lovely viewers that if you're new to my channel, please subscribe my channel, and if you find the content helpful, please do like and share my videos. And the special thing about these videos is that we are not just going to discuss the questions and the right answer from the choice. Okay, we'll discuss the question. Okay, we'll try to understand the answer. Okay, because if we understand and learn, we can remember it for a long time, and we can also explain it to the others. So we'll try to understand and learn. Okay, so let's get started. The first question is that we are going to discuss is, what is the difference between measles and rubella? Okay, so the difference between measles and rubella, the answer is spot fever. Okay, see, measles and rubella both are viral infections, and both are caused by different viruses, but they are highly contagious airborne infections. Okay, rubella is also called as the German measles. Okay, but the difference is spot fever. In rubella, what happens is the patient will have sudden high grade fever, okay, which will last for about 3 to 4 days, and once the fever starts fading, the patient will develop rashes. Okay, so that's the difference between measles and rubella. Both are viral infections, both are highly contagious airborne viruses, but there is a difference. Okay, that is spot fever. So this is the right answer. Then the next question, doctor ordered to give 1000 international units of heparin, and the available is 5000 international units per 5 ml. How many ml the nurse will give? Okay, the options are 1 ml, 2 ml, 3 ml or 4 ml. See, there is a formula, required dose by stock dose into stock volume. So the available dose is 5000 international units and volume is 5 ml, and required dose is 1000 international units. So if 5 ml contains 5000 international units, then 1 ml will give 1000 international units. Okay, so we have to administer 1 ml to the patient. Okay, so it is required dose by stock dose into stock volume. If we put this in the formula, we'll get the answer. 1 ml is equal to 1000 international units. Okay, then the next question, rheumatic fever test is, they have given 2 options, blood culture or anti-streptolysin test. See, not blood culture. Actually, rheumatic fever, there is no single test to diagnose this. There are many other tests that we do, like CRP and ESR and all that. But yes, if in rheumatic fever we test for ASO titers, yes, ASO titers, that is anti-streptolysin O titer. Okay, see, if the person has got infected by the streptococcal group of bacteria, then it will produce a substance called streptolysin O, okay, in the blood. And this test is done to check for the antibodies which are produced against this substance, that is streptolysin O in the blood. So if the person has got infected by the streptococcal infection, it will produce, this bacteria will produce a substance called streptolysin O, and we are doing this test to test for the antibodies which are produced against this substance, that is ASO titer we check for, okay, in the rheumatic fever. Done, guys? Okay. Okay, the next question is, as identified by Dr. Elizabeth Kubler, which stage of dying is characterized by transition from no, not me, to yes, me, but The answers, I mean the options they have given are anger, depression, acceptance, bargaining. So guys, I think you all remember Dr. Elizabeth Kubler-Ross, who described the 5 stages of grief in a person who is dying. Yes, there are 5 stages, right, that he has discussed. That is denial, anger. The patient goes through the 5 stages: denial, anger, bargaining, depression, and at last acceptance. So if the patient who's dying, if the patient is characterized, transition from no, not me, to yes, me, but there is still but there. Okay, that means the patient is in which stage of grief? That is bargaining. Okay, bargaining. That means the patient has already crossed the denial, anger. The patient is in bargaining stage of grief. Okay, Dr. Elizabeth Kubler-Ross, he described these 5 stages of grief in a person who's dying. Okay, so the person is in bargaining stage. Okay, then the next question is, the hospice nurse visits a client who is dying of ovarian cancer, and during the visit the client says, if I can just live long enough to attain my daughter's graduation, I will be ready to die. Which of the following phases of coping is this client experiencing? Again, the 5 stages of grief. Okay, anger, denial, bargaining, or depression. Which stage the patient is in? That means the patient has already crossed the denial and the anger stage. Okay, she knows that she is going to, but still trying to bargain. Okay, so the answer is in the bargaining stage. Okay, the coping stage which she is going through now at present is bargaining stage. Okay, she knows that she is going to die. Okay, she knows that her lifespan is this much, but still she's just trying to bargain, saying that if I can survive till my daughter's graduation, then I'll be ready to die after that. Okay, just trying to bargain with the things. Okay, so that is bargaining. The answer is bargaining. Then the next question, a female patient diagnosed with cancer, she intended to spend a part of her money for the poor people in case of her cure. This action by the patient is considered as, again, the 4 stages they have given as option: denial, acceptance, bargaining, or anger. Okay, so she's suffering from cancer, and she intends to spend her part of money for the poor people in case of her cure. Okay, she thinks that if she spends some money for the poor people, it will help her to cure. Okay, that means she is in which stage of coping or which stage of grief? That is bargaining again. Okay, that means the patient has already crossed the denial and the anger stage. They are in bargaining. Next will be depression and acceptance. Okay, so these 3 questions, okay, which are describing about the bargaining stage, coping stage of the person who is dying. Okay, the next question, they said that the head staff gave all of them low evaluation because she did not have time to review their work. What is the behavior of the head nurse in this situation? The head nurse has given a low evaluation to all the other staff, saying that she don't have time to review their work. So what you call her this behavior as with regard to her staff? It is halo effect or horn effect. See, halo effect and horn effect, these are 2 opposite cognitive process, guys. Okay, these are 2 opposite cognitive process. Halo effect is the first positive impression of a person that will make us treat that person more favorably, whereas horn effect is the first negative impression of a person that makes the person treat that person less favorably. Okay, so this is halo effect is the first positive impression, and horn effect is the first negative impression that makes the person treat the other person less favorably. So she gave low evaluation to all of them. I mean, she gave low evaluation to her staff. So this is horn effect, not the halo effect. That means she has some negative impression regarding them. Okay, and without further evaluating, she treated them with less favor. So that is horn effect. Okay, not halo effect. Then the next question, adult CPR, they have given the options: 30:2, 100 at 5 centimeter, 15:2, 120 at 5 centimeter, 15:2, 120 at 5 centimeter, 30:2, 100 at 4 centimeter. See, 15:2 and all, this is for the children that we practice. Okay, So the right answer is 30:2. This is the compression ventilation ratio. 30 compressions, 2 ventilation. Okay, 100 to 120 compressions per minute we have to follow, right? The CPR cycle. Okay, and at 5 centimeter the depth. Okay, so the compression rate and the compression depth. Okay, so this is very important for a high quality CPR. Yes, compression rate and compression depth to be maintained. For adult CPR, it is 30:2, 100 to 120 compressions per minute at 5 centimeter depth. Okay, fine. Then the next question is, guys, hope you all are with me and trying to practice these questions. Okay, the next question is, dash in false labor, what are those contractions called that are irregular and do not produce dilatation, effacement or descent? Okay, see, when the person is in true labor, when there is a true labor, the contractions are quite strong. Okay, they are regular, strong, and that will produce the dilatation of the cervix and the baby will descend down. But whereas in false labor, the patient will have something called Braxton Hicks contraction. Okay, the answer is Braxton Hicks contraction. This is false labor. They are also known as prodromal labor pains, okay, or false labor pains. Okay, the patient will have tightening and irregular contractions around the umbilicus. Okay, and this is false labor. Okay, this will not cause dilatation of the cervix. This will neither cause effacement or descent of the baby. Okay, so this is not going to help. So this every patient will have this. Okay, every patient may have this Braxton Hicks contraction, false labor. Okay, so the answer is Braxton Hicks contraction or false labor, which is also known as prodromal labor pains also. Fine. The next question, influenza in Hong Kong and killed of millions of people, consider as epidemic or pandemic. What it is called, epidemic or pandemic? See, it is called as epidemic because epidemic is when the outbreak of the disease is within a particular region. Pandemic is, it is worldwide, right? Like for example, you can take COVID-19. Yes, it was a pandemic, yes, worldwide. In many countries it broke. But whereas this influenza, it was only in the Hong Kong, okay, which originated in China, which is also called as Hong Kong flu. Okay, it is called an epidemic, not a pandemic. Fine. Then the next question, otitis media surgery is dash, myringotomy or tympanoplasty. What is the right answer? The right answer is myringotomy. See, otitis media is actually the infection of the middle ear. Okay, it is an infection of the middle ear. And the surgery to treat it is myringotomy, not tympanoplasty. See, tympanoplasty is the surgery in which they are going to fix the holes in the eardrum. Okay, the eardrum is having holes which are not healing on their own, and in tympanoplasty surgery they fix these holes of the eardrum. Whereas in myringotomy, what they do is they create a hole in the eardrum to allow the fluid, may it be pus or blood or water, whatever it is that got stagnant and infected in the middle ear. They make a hole in the eardrum to drain out that fluid, and sometimes they also put a small tube, okay, so that they can maintain the drainage. Fine. So the surgery to treat for otitis media, which is the infection of the middle ear, is myringotomy, not tympanoplasty. Okay, guys? Fine. Guys, it is helping. You all are with me? Okay. The next question. A 13 weeks pregnant multigravida woman is anxious and apprehensive. She has 5 children and is not willing to continue with this pregnancy. She is requesting the midwife to abort the fetus. She is underweight, malnourished and is overworked. BMI is 17 kg per meter square, and what intervention is desired immediately? Admission and IV line management for induction, family planning and birth control measures, dietary management and supplements, or support, reassurance and counseling. The right answer is support, reassurance and counseling. We are not going to encourage her abort it immediately because she is a multigravida. Okay, though she is having 5 children, it is a financial issue, but the thing is we also need to consider that it is a 13 weeks pregnancy. That means she already entered the second trimester. See, first trimester is from first week to 12th week, end of the 12th week, first trimester finishes. 13 weeks started, that means she is in second trimester. And when we carry out an abortion in second trimester, that too in a in a lady like this who's underweight and malnourished, it can cause abortion related complications like infection, bleeding, okay, there are perforation, many other things. So that's the reason she need support, reassurance and counseling rather than immediately what we say, carrying out the intervention of abortion, okay, which can cause problem to her. Fine guys. Okay, the next question: during the research process, when should a hypothesis be developed by a researcher? The options are before any statistical analysis, or after a research design is determined, before development of the research question, after development of the research question. The right answer is after development of the research question. Okay, see guys, research, guys, you remember it is a subject in our fourth year, yeah, BSc fourth year. Research subject, okay, quite dry. I feel it's quite complicated, and yes, but it's very interesting also. Yeah, if we get into the subject, it's really interesting, but initially it sounds quite dry. Okay, but so in a research, hypothesis is what, guys? Hypothesis is an assumption, okay, an idea that this can be the cause of this. Okay, so this can be done only after the development of a research question. Okay, after the research question is developed, then only a hypothesis can be developed. Okay guys, so the answer is after development of the research question. The next question: ER witnessing a victim escaping from a house fire. A passing nurse aids the individual and he has sustained burn to the face, neck, smoke inhalation, and is having slight difficulty in breathing. Obviously, right, the patient is having smoke inhalation injury, that means the patient will surely have breathing difficulty. Okay, so which of the following is the most appropriate to perform while waiting for the emergency medical personnel? Okay, the patient, we are waiting for the emergency team to arrive. So what we can do? Options are: place in supine position and give rescue breathing, place in a comfortable position and monitor for patency of the airway, keep the patient in standing position and support while leaning on the wall, or place a wet towel over the face of the patient and placed in supine position. Okay, the right answer is place in a comfortable position and monitor for the patency of the airway. See, smoke inhalation injury are the associated injuries in case of burns which can complicate the condition. Okay, treatment of the smoke inhalation injuries, this requires high flow oxygen and bronchodilators, but the emergency team has not yet arrived as mentioned in the question. We are waiting for the emergency team. So meanwhile, we can give the patient a comfortable position and monitor for airway patency, because the patient is at high risk of airway obstruction due to the necrotic bronchial epithelium or the Fabrin cast slot or secretions or because of the bronchospasm. Okay, and this can cause again atelectasis, which can lead to pneumonia. So that's the reason we have to monitor for airway patency. Okay, and once the emergency team arrives, we can go for subglottic airway, that is intubation if necessary. Okay, so in smoke inhalation injury, see, when there is a smoke inhalation injury, if the patient is unconscious and not breathing, immediately we can start the CPR. But if the patient is conscious, okay, patient is conscious and not responsive, that means the patient is still breathing. So we need to monitor the patient, okay, for airway patency. Then the next question and the last question of our video, okay, because we are going to discuss only 15 questions in each. Hemorrhagic fever disease caused by viruses. Which viruses? Okay, so see, hemorrhagic fever disease, it's a group of disease that are caused by several distinct families of the viruses. Okay, and the answer is Arinaviridae, Filoviridae and Flaviviridae. These are the families of the viruses which can cause hemorrhagic fever. Okay, it is a condition that affects many organ systems of our body, okay, which damages the overall cardiovascular system and it decreases the body's ability to function on its own. Okay, very complicated. So this is caused by the viruses from these three families: Arinaviridae, Filoviridae and Flaviviridae. Okay guys, so these are the three families of the viruses that can cause hemorrhagic fever. Okay guys, so hope that this 15 MCQs that we have discussed will be helpful to you in practicing and preparing for your Prometric examination. Okay, so if you find the content helpful and if you liked it, then please do subscribe my channel and like and share my videos so that it is helpful for the others too. Okay, so stay connected with Nurses, the Heart of Healthcare. Keep learning, keep growing, and as I always say that medical science, it's a very interesting subject, very lovely subject, and there is a lot of depth in it. So every day try to learn something new. Even if till our last breath we keep learning, there'll be still something new to learn. Okay, no doubt about it. And understand and learn and teach others simultaneously. Okay, and try to be a very good human each day, a better human each day, and help others. Okay, thank you so much for watching.